Welcome. Today we're diving into the world of care work and its profound economic impact. Care work includes both paid and unpaid activities such as childcare, eldercare, and healthcare support. Often these essential tasks are overlooked in economic discussions, yet they form the backbone of our societies. In this video we'll explore how care work drives economies, supports families, and why recognizing its value is crucial for a sustainable future. Let's begin by understanding what care work really means and why it matters to everyone, not just those directly involved. Care work refers to activities that provide direct care, support, and nurturing to others. This includes looking after children, supporting elderly family members, and assisting those with health needs. Care work can be performed in homes, hospitals, or community centers and is often unpaid or underpaid. Despite its critical role, care work is frequently undervalued in economic terms. Recognizing the full scope of care work helps us appreciate its importance and the people who perform it every day. Care work comes in two main forms: paid and unpaid. Paid care work includes jobs like nursing, childcare providers, and home health aides. Unpaid care work, on the other hand, is often done by family members, especially women without financial compensation. Both forms are vital, but unpaid care work is rarely counted in official economic statistics. This distinction is important because it highlights the invisible labor that keeps households and communities functioning smoothly. Unpaid care work is estimated to contribute trillions of dollars to the global economy each year. If this work were compensated, it would represent a significant portion of a country's GDP. Yet because it's unpaid, it often goes unrecognized in economic planning and policy. By assigning value to unpaid care, we can better understand its true impact and advocate for policies that support caregivers. Globally, women perform the majority of care work, both paid and unpaid. This gender imbalance has deep roots in cultural expectations and social norms. Men are increasingly participating, but women still shoulder most of the responsibility. Understanding who does care work helps us address inequalities and design better support systems for all caregivers. Because women do most care work, they often face barriers to full economic participation. This includes limited time for paid employment, lower lifetime earnings, and reduced access to social protections. Addressing gender inequality in care work is essential for achieving broader economic and social equality. Policies that support shared caregiving responsibilities can help close this gap. Paid care workers, such as nurses, childcare providers, and home aides, play a vital role in society. They support families, enable others to work, and contribute to public health. However, these jobs are often low paid and lack benefits, despite their importance. Improving wages and working conditions for paid care workers benefits everyone by ensuring high-quality care and economic stability. Care work is a key driver of economic growth. By enabling parents and family members to participate in the workforce, care workers help boost productivity and economic output. Investments in care infrastructure such as childcare centers and elder care facilities create jobs and stimulate local economies. Recognizing care work as an economic engine is crucial for sustainable development. Much of care work happens within the home, from cooking and cleaning to caring for children and the elderly. These daily tasks are essential for the well-being of families and communities. While often invisible, home-based care work supports the health, education, and productivity of all household members. Recognizing its value is the first step toward fairer economic policies. Childcare is a major component of care work with significant economic implications. Access to affordable, quality childcare enables parents, especially mothers, to pursue employment and education. This not only improves family incomes but also increases overall workforce participation. Investing in childcare services is a smart economic strategy for any country. As populations age, the demand for eldercare is rising. Providing care for older adults is both a social responsibility and an economic challenge. Eldercare supports the dignity and health of seniors while also creating jobs in the care sector. Planning for the economic impact of aging populations is essential for future prosperity. Healthcare professionals are a vital part of the care workforce. Their work not only saves lives but also supports economic productivity by keeping people healthy and able to work. Investing in healthcare systems strengthens economies and improves quality of life for everyone. The link between healthcare and economic growth is undeniable. When care work is undervalued or ignored, societies pay a hidden cost. Families may struggle, workers may be forced to leave jobs, and economic growth can slow. Recognizing and investing in care work helps prevent these negative outcomes and build stronger, more resilient communities. Traditional economic measures like GDP often exclude unpaid care work, leading to an incomplete picture of economic activity. Some countries are now experimenting with ways to include care work in national accounts. This shift can help policymakers make better decisions and recognize the full value of all work. Caregivers often lack access to social protections like paid leave, health insurance, or pensions. Expanding these protections to include care workers, both paid and unpaid, is essential for economic security. Social protection policies can reduce poverty, improve health, and support gender equality. Investing in care work has a multiplier effect on the economy. When caregivers are supported, they can participate more fully in the workforce, spend more, and contribute to economic growth. This creates a positive cycle that benefits individuals, families, and society as a whole. Quality care work, especially in early childhood, lays the foundation for lifelong learning and success. Children who receive proper care and education are more likely to thrive academically and economically. Investing in care work is investing in the next generation's potential. Care work strengthens social bonds and builds trust within communities. When people feel supported, they are more likely to contribute positively to society. Social cohesion, in turn, supports economic stability and resilience in times of crisis. Care workers face many challenges, including low pay, long hours, and limited career advancement. Many also lack job security and benefits. Addressing these challenges is essential for attracting and retaining skilled care workers, which benefits everyone. Around the world, there is a growing gap between the demand for care and the supply of care workers. This global care crisis threatens economic stability and the well-being of millions. Solutions require coordinated action from governments, businesses, and communities. Many care workers are migrants who move to other countries in search of better opportunities. Migrant care workers fill critical gaps in care systems but often face challenges such as discrimination and lack of legal protections. Supporting migrant care workers is vital for global care systems. Technology is changing the landscape of care work. From telemedicine to smart home devices, new tools can support caregivers and improve care quality. However, technology cannot replace the human touch that is central to care work. Balancing innovation with personal connection is key. Effective policies can support care workers and recognize their economic contributions. This includes investing in care infrastructure, providing training, and ensuring fair wages. Governments play a crucial role in shaping a care-friendly economy that benefits everyone. Businesses also benefit from supporting care work. Family-friendly policies such as flexible hours and parental leave help employees balance work and caregiving responsibilities. This leads to higher productivity, lower turnover, and a more engaged workforce. Communities can play a vital role in supporting caregivers through local programs, support groups, and shared resources. When caregivers feel supported, they are better able to provide quality care and maintain their own well-being. Education and training are essential for professionalizing care work and improving care quality. Access to training programs helps care workers develop new skills, advance their careers, and provide better support to those in need. Care work can be emotionally demanding, leading to stress and burnout. Supporting the mental health of caregivers is crucial for their well-being and the quality of care they provide. Access to counseling, respite care, and peer support can make a big difference. Encouraging more men to participate in care work can help balance responsibilities and promote gender equality. Changing social norms and providing incentives for men to engage in caregiving are important steps toward a more equitable society. Care work builds economic resilience by supporting families during crises such as health emergencies or economic downturns. Strong care systems help societies recover faster and adapt to changing circumstances. Recognizing and investing in care work is essential for achieving sustainable development goals. Quality care supports health, education, and gender equality, all of which are pillars of sustainable societies. The future of care work depends on how societies value and support caregivers. With aging populations and changing family structures, the demand for care will only grow. Forward-thinking policies and investments are needed to meet these challenges. Innovative approaches such as community-based care models and digital platforms are transforming how care is delivered. These innovations can improve efficiency, reach more people, and enhance the quality of care. Economic justice means ensuring that all workers, including caregivers, receive fair compensation and recognition. Addressing wage gaps and improving working conditions in the care sector are key steps toward a more just economy. Supporting care work can help reduce poverty by creating jobs and enabling more people to participate in the workforce. Social policies that value care work lift families out of poverty and contribute to inclusive economic growth. Balancing work and caregiving is a challenge for many families. Policies like flexible hours, parental leave, and affordable care services help people manage both responsibilities, leading to healthier, happier lives. Economic inclusion means everyone has the opportunity to participate in and benefit from economic growth. Recognizing care work as valuable labor is a step toward greater inclusion, especially for women and marginalized groups. Much care work takes place in the informal economy, where workers lack legal protections and benefits. Formalizing care work can improve job quality and economic security for millions of workers worldwide. Public investment in care infrastructure, such as childcare centers and elder care facilities, creates jobs and supports economic growth. Governments have a key role in funding and regulating care services for the benefit of all. Social innovation in care work includes new ways of organizing, delivering, and financing care. Examples include cooperative care models, time banks, and community-based solutions. These innovations can make care more accessible and sustainable. During economic downturns, investing in care work can accelerate recovery by creating jobs and supporting families. Care work is a resilient sector that continues to be essential even in times of crisis. Demographic changes, such as aging populations and declining birth rates, are increasing the demand for care work. Societies must adapt by investing in care systems and supporting caregivers to meet these new challenges. Recognizing care work as a human right means ensuring everyone has access to quality care and that caregivers are treated with dignity and respect. Human rights-based approaches can guide policies that support care work and promote social justice. Sustainable care work practices can also benefit the environment. For example, community-based care reduces the need for long commutes, and green care facilities use energy-efficient designs. Linking care work with environmental sustainability creates a healthier future for all. Care work is central to global development efforts. International organizations are increasingly recognizing its importance in achieving economic and social goals. Supporting care work worldwide is key to building inclusive and prosperous societies. In conclusion, care work is the foundation of healthy, thriving economies and societies. By recognizing its true value, supporting caregivers, and investing in care infrastructure, we can build a more just, inclusive, and prosperous future for all. Let's continue to advocate for the recognition and support that care work deserves.